Welcome. So y'all haven't heard from me in a while. I'm Brian Weimer, officer here at University. Lisa is in New York, and I forgot to put up the name tag, so maybe don't mention that. Lisa likes the name tag. So. But a couple of announcements. Following the presentations, we put the materials on the Tulane Research Compliance website and also on Canvas. So you can.
They are on Canvas? I haven't seen them on Canvas.
It's new. It just came.
Like today?
Like as in a couple
As
days.
in I realized yesterday that they weren't there. So they are there now. Thank you, Kate. If it's your first time attending one of our seminars, we'll have a sign-in sheet to sign in at the end of class, but only if this is the first time you're coming. Everyone else will do the card swipe as we usually do at the end. And our topic today is research misconduct. Allegations of fabrication of research results, falsification of research results, or plagiarism. And this topic is very much related to our discussion that Dr. Deininger led on data management and proper keeping of laboratory notebooks. Because if someone ever questions the integrity of data you're working with, or you're working with data and you have some questions about the integrity of it, the best way to resolve those is to have available the raw data supporting the results and the corresponding lab notebooks. And if those are not available, it makes resolving those questions about the integrity of the data much more difficult, if not impossible. But the two topics are very much related. Our discussion leader today is Dr. Bruce Bunnell, who is the director of the Tulane Center for Stem Cell Research and Regenerative Medicine, and is a tenured faculty member of the Department of Pharmacology here at the Tulane School of Medicine. And Dr. Bunnell's academic background includes obtaining a Bachelor of Science from Purdue University, a PhD from the University of Alabama at Birmingham in microbiology, and postdoctoral fellowships at Howard Hughes Medical Institute, as well as in pharmaceutical research at Park Davis Warner Lambert. And Dr. Bunnell spent several years as the senior staff fellow in clinical gene therapy branch of the National Human Genome Research Institute at the NIH in Bethesda. He is an author on more than 150 peer-reviewed journal publications. He serves on the editorial boards of seven journals and has served as the PI or co-PI on many funded grants. He holds a patent, and most importantly, he's been, or most importantly to me, an integral part of our efforts here at Tulane University to foster research integrity. The fun fact about Dr. Bunnell, when he's not traveling the world speaking about regenerative medicine, he enjoys running previously marathons, now half marathons, which I aspire to do. So welcome, Dr. Bunnell. We're so pleased to have you here. Thank you.
So it's glad to be back. I've given this lecture in various forms for several years now. So is anybody brave enough to tell me what you think research misconduct encompasses? Anybody have any thoughts they'd like to share before I get started? The reason I ask that question is many people, even people at my level, believe if it's not published in a paper, it's not research misconduct. Is that kind of your impression as well? No? So you guys are aware that it actually encompasses other things. Not just because it's not published in a paper means it didn't really happen, even though it really happened. It doesn't count because it wasn't published in a journal article or in a book chapter. And that was really the point today, is research misconduct goes beyond the simple former thought of, well, if it's not in a paper, it doesn't count because it didn't happen then, because I didn't publish a paper. It actually comes in many forms, and we'll walk through much of that today, I hope. And hopefully you'll leave here kind of understanding what it is, what it encompasses, and more importantly, how to deal with it, and more importantly, for you as an individual, how not to get yourself in that situation. All right. So in the previous years, I did an interactive poll. I didn't really want to do that this year, but we're going to go through three real-world cases, and you can tell me whether you think they're scientific misconduct or not before we get into the bulk of the lecture. So a faculty member at the University of Vermont College of Medicine admits to falsifying data in 17 grant applications to the NIH and fabricating data in 10 publications over a period of 10 years. Is that research misconduct?
Yeah.
That's pretty obvious. I mean, that's kind of the definition of research misconduct. So, yes, we're all starting at a good basic understanding of what research misconduct. That's good. And that is a real world case, and the faculty member was pretty severely punished. So Eric Pullman, who was the researcher, and the one thing about findings of research misconduct is they are made public, especially if it's NIH funding is involved. So your name is out there forever as having conducted and been found guilty of research misconduct. So Eric Pullman was banned forever from seeking or receiving public research money, so NIH money, NSF money. He had to retract those 10 scientific papers. And he was actually given a prison sentence of 1 year and 1 day for falsifying data in a grant application. And he had to pay back $180,000 to the United States government. So part of the reason I show this is the punishments are very, very severe, especially because you're defrauding the United States government. You've made a contract with them saying, I presented real and honest data to you. You're giving me money to do research.
Was his motivation totally that for money, or did he believe he was right? And
we will get into why people do research misconduct, but quite often there's career pressure. You're an assistant professor. You're trying to get tenure. Your institution comes to you and says, you better start getting grants and publishing papers. And people will sometimes go to extreme measures to make that happen for themselves. He was more of a established investigator. Some people do it because they want to be famous. I want to be known as Mr. Whatever. I cured this disease. And so they resort to strange means to get there. Question 2. Faculty member provides a hypothesis regarding visual working memory research, and a student conducts experiments funded by the National Institutes of Mental Health and the NIH. The student obtains results that are in line with the hypothesis. The data also contains outliers. The student removes the outlier value. The research is eventually published. Is that research misconduct?
Yes.
Are we sure?
Explain the outliers, but don't remove them.
So yes, this is research misconduct. So David Anderson, a graduate student at the University of Oregon, Eugene, was found to have engaged in research misconduct. 4 papers were retracted handed correctly. He was not, he didn't go to prison or anything like that. Somebody sneezing or breathing really hard into the microphone? Doesn't sound good, whoever it is. All right. Question 3. A researcher conducted experiments for specific protein expressions in human-induced neuronal cells derived skin fibroblasts of Alzheimer's disease patients and unaffected individuals. The researcher inflated the sample size of the quantitative data in some bar graphs in an unpublished manuscript. That research was kind of.
Yeah.
Why?
Did you?
Somebody else might use it.
Yeah, the sample size. Yeah.
Yes. So Ryosuke Fujita, then a postdoc at Columbia University, was barred from federal grant funding for 3 years and could not be a grant reviewer for the same amount of time. So research misconduct, goes back to my original question, is not limited to published manuscript. The misconduct was inflating the sample size and reporting it as part of the research results. So even if you get up in a lab meeting and presented that data, that's research misconduct. You write it down in your notebook. Here's my data. That's research misconduct. So here's what we're trying to avoid. I found this picture on the internet. My first fraud kit performed decades of scientific fraud. No experimentation necessary. So this is what we're trying to avoid. That's not the point of today's lecture. Is to get this kit. It's to teach you that you don't need this kit. You actually need to do the scientific research. So we're going to introduce the concept and issues surrounding research misconduct. And feel free to stop me and ask questions anytime you need. Review the case studies on research misconduct allegations. I have some real world cases that are more recent. We'll decide kind of whether they're misconduct and why. And to better understand the regulations and Tulane University policies and research procedures applicable to research misconduct. So the good thing about giving this lecture is Brian and or Lisa are always here. So if you guys ask me a question I don't know, I have the experts in the room to answer the question.
You don't mind me butting in?
Not at all.
Okay.
So prior to World War II, little public funding for research existed. So there really wasn't an organization like the NIH that you could turn to get money to do research. But today, public funds support about a third of all research and development in the States and about half of all basic research. So as public funding for research has grown, interest by the public, whose tax dollars are the ones funding that research, through its elected officials, has resulted in increased regulation and oversight of research. So people want to know what happens to their tax dollars and what they're spent on and whether they're spent legitimately. So federal laws on research misconduct, the public concern over research misconduct initially rose in the 80s. I'm not saying that research misconduct didn't happen before the 80s, but it really wasn't until the 1980s that it started to become a central focus, that people were out there performing research misconduct. And at the time, research institutions sometimes ignored or covered up the potential misconduct because it can make an institution look bad. If an investigator at your institution is found to be guilty of research misconduct and that becomes public knowledge, some institutions are worried about their reputation. So in December of 2000, the Office of Science and Technology adopted a federal policy on research misconduct. You can find it there in the public health policies on research misconduct. Essentially, all institutions receiving public health service funds must have written policies and procedures for allegations of research misconduct. It covers any entity that applies for research training, or research-related or cooperative agreement with public health service. So every major university, private research institutions, anybody that can get NIH money has to have a policy on research misconduct and how it's going to be handled and what the policies are at the institution for investigating and adjudicating an answer. So establishes the definitions for research misconducts. It outlines procedures for reporting and investigating misconduct. And most importantly, it provides protection for whistleblowers and persons and the people accused of the misconduct. So if you are the person that reports the misconduct, you cannot be punished or have anything happen to you. And if you are the person accused of misconduct, you of course are innocent until proven guilty. I just go straight for the punishment. No, you're innocent until proven guilty, and the university does a very good job, at least Tulane, does a very good job of keeping this private. So if you are ever accused of it, it's not like the entire university is going to know when it happens. Brian's office does a really good job of keeping it limited to only the people that need to know.
Just because it's in the news a lot today, there's no chance that a whistleblower here would have to report the whistleblowing event to the person who they think did something wrong, right?
Good question. So as a whistleblower, you can go straight to Brian's office. You do not have to go.
Brian, you never do anything
You don't
wrong.
necessarily have to go to your boss. You don't necessarily have to do any of that. There's always an avenue where you can take care of things.
And there's also a hotline
Yes.
for any
Anonymous
Yeah.
tip line.
Yeah,
It's
for-
just, topical.
So each university has a research integrity officer. This person is the individual authorized to receive and investigate allegations of misconduct. Technically, our research integrity officer is our brand new vice president of research, Dr. Giovanni Piedmonte. He's very new to the job. He's never had this job before, so I am certain right now he's relying tremendously on Brian and Lisa's office for advice and input, but technically he is the research integrity officer. So functions of the research integrity officer are carried out by Lisa at Tulane, by Lisa and Brian, who you all know.
for the delegated readers.
Yes. So they keep the VPR apprised of what's going on. The VPR is not actually involved in any of the investigations unless he or she needs to be. All right. So the public health service mandated institutional procedures are there have to be provisions for an initial inquiry to determine if the allegations have merit. Typically a Tulane that's handled through Brian's office or in Brian's office. There are provisions for a formal investigation to determine the truth of the allegation. There's the designation of an individual authorized to adjudicate the conclusions of the investigation and impose administrative actions to redress the misconduct or to vindicate the person charged. And there are provisions for reporting the findings to the Office of Research Integrity. And so here at Tulane, things are often handled in Brian's office. As I said, they go to the Vice President for Research, and quite often they may make it up to the Provost office. That's who the Vice President of Research reports to, is the Provost. So the Office of Research Integrity develops policies, procedures, and regulations related to the detection, investigation, and prevention of research misconduct and the responsible conduct of research. It reviews and monitors research misconduct investigations conducted by the applicant and awardee, institutions, intramural research programs, and the Office of the Inspector General in the Department of Health and Human Services, and it recommends research misconduct findings and administrative action. It provides technical assistance to institutions to respond to allegations of research misconduct. It implements activities and programs to teach responsible conduct and research, such as this lecture series, promote research integrity and prevent research misconduct. It conducts policy analyses and evaluations in research to build a knowledge base in research misconduct, research integrity, and prevention. It also administers programs for maintaining institutional assurances, responding to allegations of retaliation against whistleblowers as well.
And related to the question about how to report and where, this is another avenue that one could anonymously report an allegation to the Federal Office of Research Integrity.
Yes.
And if that was about a person, if the allegation was against someone at Tulane, Office of Research Integrity would then send it to us, conduct our process.
Yes. So according to the Federal Office of Research Integrity, in general terms, responsible conduct of research is good citizenship applied to professional life. Researchers who conduct and report their work honestly, accurately, efficiently, and objectively can achieve RCR. So recommendations on misconduct: to adopt a zero tolerance policy, protect whistleblowers, clarify how to report, train the mentors, and model ethical behavior. Tulane has done all of these things and done them really well. When I first came to Tulane, this was a very murky area, and it's been really honed down and really an efficient process now. So what is research misconduct? We talked a little, Brian alluded to it in his introduction. It's essentially defined as fabrication, falsification, or plagiarism in proposing, performing, or reviewing research results. So it's not just I published a paper with something made up in it, or it's not research misconduct because I didn't publish a paper with it. It encompasses all of these things. Plagiarism also falls into that, as it says here in the definition. Many people don't realize that. And now, I don't know that the NIH uses it, but many journals actually have plagiarism software. So when you submit your paper, it will screen it for phraseology that comes from other papers. I had a colleague, it's actually kind of a funny story. A colleague of mine submitted a paper, and the journal sent back, I don't know if we can accept this paper. We ran it through our plagiarism checker, and it was, say, 20% similar to some other papers that were out there. Here's the papers. They were all his papers. So he ended up changing the language just to get it into the journal, but that's one of the issues with plagiarism. When you write a lot of papers in your field, you adopt a style and a phraseology by which you write about your topic. Mm-hmm. And you're going to use those phrases over and over again. So I think journals have to be careful of, if it's your paper, is it really plagiarism? If it's someone else's paper, it certainly is. All right, so 3 categories of scientific misconduct: fabrication, which is out and out just making up of data; falsification, which is distorting data. So there's real data there, you just distort it in such a way that it conforms to the story that you wish to tell. And then, of course, there are questionable research practices such as cooking data, mining data, and concealing conflicts of interest. Conflicts of interest are becoming more and more apparent as well. A lot of scientists have ties to companies or have their own companies or receive funding from drug companies, and some of the research misconduct cases over the last, say, 5 to 10 years involve scientists testing drugs in patients, never divulging the fact that they're on the board or hold stock in whatever pharma company the drug they're testing is made by. So fabrication, again, is making up a result and recording or reporting them. Falsification is a manipulation of research materials, equipment, or processes, or changing or omitting research results that the research is not accurately represented in the record. Plagiarism is the appropriation of another's ideas, processes, results, or words without giving proper credit. So when you make a talk and you have a figure in there that you borrowed from somebody's paper, you always put the reference in there? Because you should, because it's not your data, it's somebody else's data. So even if you just put, if it's from Bruce Bunnell, Science 1988, even if you just put Science 1988, that's good enough. But you have to acknowledge where that figure came from, because it's not your data. Sometimes students aren't aware that they need to be doing that. So research misconduct represents a significant departure from accepted practices, has been committed intentionally or knowingly or recklessly, and can be proven by a preponderance of the evidence. So you have to meet all of those criteria. So if it's truly an honest mistake, or you published a paper and your colleague, who's your biggest competitor, just doesn't agree with your findings, that's not research misconduct. That's just a disagreement. So you do have to be careful. And if you're going to be the accuser, you really have to be certain that you're 100% correct, or you're 100% in belief of what you're going to report.
And that sometimes, it can be difficult to tell, and that's something that our office is
You can always go and consult with them and say, here's what I think, and they can offer you guidance.
Because sometimes it's more an issue of, actually, it's non-compliance with, say, human subject regulations or animal welfare regulations, as opposed to research misconduct. So we can help figure that out.
Yeah. So research misconduct does not include honest error, misinterpretation of the results, or differences of opinion. And that's important to highlight. Top bad behaviors: fabricating or cooking research data, ignoring major aspects of human subject requirements, and we'll talk a little bit about that. Not properly disclosing involvements in firms whose products are based on one's own research. Relationships with students, research subjects, or clients that may be interpreted as questionable. Using another's ideas without obtaining permission or giving due credit, plagiarism. I've seen scenarios where a senior faculty member is on a graduate committee for a student in someone else's lab, and they have taken that student's data and used it in a grant application and never acknowledged the other laboratory and actually got the grant funding. That's about as bad as you can get, in my opinion. Unauthorized use of confidential information in connection with one's own research. Failing to present data that contradicts one's own previous research. Overlooking others' use of flawed data or questionable interpretation of the data. Changing the design, methodology, or results of a study in response to pressure from a funding source or a PI. Publishing the same data or results in 2 or more publications. And that happens a lot too. There's so many publication avenues now that there have been papers published where it's essentially the exact same paper. Maybe they'll change the title, but all the data is exactly the same. They'll send it to 2 different journals, get it published, and on their CV, it's 2 publications. Who's the wiser, right? And now they actually have the ability to look for that type of stuff.
What is the third point here? Overlooking others' use of flawed data. How do we know it's flawed, that data is?
You may not know.
Yeah.
But, if you're, say, talking to a colleague that's in your field and he comes to you and says, we published a paper about a year ago and it showed all this, but I can't recapitulate it. And you go back and you ignore it and you keep publishing along the same vein, I would say that's a pretty good use of knowledge of, you knew the data was flawed, but you kept going down the avenue. Well.
You mentioned that questionable interpretation of data.
Yes.
And earlier you said that something that can be more like an academic disagreement on the interpretation of data. How in what's like which scenario will that? This
So essentially, I think the difference is, so it's not an honest mistake. You knowingly did that. And in terms of the disagreement on the data, again, it's not research misconduct. It's really an honest disagreement on the data. And the way, maybe it's not so much the way the data was interpreted, but what it means to your field could be disagreed upon. It doesn't mean either one of you is wrong. It's just you have a different perspective on the same result. So this has become such a major issue that there actually have been studies done of research misconduct. And this is a paper that was published in PNAS. I have it down there if you want to go look at it. But essentially, misconduct accounts for the majority of retracted scientific publications. So this group actually went and looked at all of the, well, I shouldn't say all, as many of the retracted scientific publications that they could, and they tried to find out why they were retracted, and it turns out the bulk of them is because of research misconduct. That's how common it is now. You can actually study it. So here's some of the data from the paper. Again, I'm not going to go through it all, but the curve on the top left graph here essentially is time on the bottom and then number of retractions on the vertical axis. So this is number of retractions, and this is time based on, I think, 5 to 10 year periods. And you can see the number of retracted papers is going up and up and up. And partly it's because of computers and computer algorithms and data to look for these things. We're much better at finding it. Probably back in the 60s, 70s, and 80s, somebody sent a paper in. They literally sat there at a typewriter for 3 weeks typing it out. You had no way of checking it.
Right.
You had to take them at their word that they were being honest and forthright about everything in that paper.
So it's about 1%, if I'm reading that right, of all papers submitted, it's about 1% that's retracted?
Well, it's where do you make that conclusion?
Percent of articles retracted for fraud or suspected
Oh,
fraud?
yeah.
Is that's
Yes.
essentially saying about 1%?
Yes.
Okay.
Of all the articles published,
Right.
yes. And then the pie charts over here are just fraud or suspected fraud, in which countries, plagiarism, and data duplication. So if you want to see that detail in, if you want to see this data in detail, you can just look up that PNAS paper.
Oh, the.
Oh.
So examples of fabrication creating data for experiments that were never done, making up subjects. So I'm supposed to do 10 mice, but I only really want to do 3, but I'll just take the 3 and extrapolate it out to 10. When I plot my graph, I'll just add 7 more mice that fall somewhere on the line. Splicing together different images to represent a single experiment. This has gotten a lot of people in trouble. So they actually now, using this software, when you have a figure in your paper, they can tell if that figure was all one figure or multiple images spliced together. It tends to be fairly commonplace for any of you do PCR or Western blots. It tends to be fairly commonplace for that, because you might run some PCR on one day and PCR on another day, and well, I got the data, let me just splice them together and I'll make a figure. Really, you should run them all on the same day at the same time in the same gel and look at them that way. So the splicing together of different images has really caught a lot of people. And it doesn't necessarily mean it's always research misconduct, the splicing together of images. But in your final publication, you really should try to avoid splicing together images. Because even if they're all honest pieces of data, it looks like it potentially could be fraudulent. Changing the brightness and or contrast of the image.
Even if it makes it clearer?
Yes. You do have to be careful.
Or explain that was done. And I'm not sure how you explain that in publication, if it's in the supplemental notes or something,
Right.
but you should
Right.
explain.
So if you have done that, you have to acknowledge that you did that somewhere.
Okay.
So I kind of had the same mindset of you if I adjust the whole image, but really adjusting the whole image really falls into this category. The big thing that used to happen is people would say, well, here's my controls over here.
Mm-hmm.
They should be dark. They should not have as intense a band as my samples over here, but when I ran my gel, they look pretty close. So I'm just going to fade these out a little bit. So that was the biggest thing.
That
But now journals have a real issue with you adjusting the brightness and contrast of an entire image, even though you think it hasn't changed anything.
well,
So what if there's a band, but then there's some ghost bands above or below? You might think they're ghost bands. Other people might not think.
or just if the image is dark and you want to brighten it so you can see what's in it.
Yes.
Okay.
So it's something you have to think about and be concerned about now. Any change that conceals information, even when it's considered not specific. Again, those ghost bands. You might say, those are just ghost bands. You technically should not remove them from your figure or your image.
But no, nowadays we see in a Western blot they show only that particular band.
Well,
Not
that's the one we're coming to, is showing only a very small part of the photograph, so additional information is not. This is very common for Western blots and PCR.
Yeah.
I got my band at 300 base pairs. I'm just going to clip around that band and say, look, I got my band. You shouldn't do that. Same thing for Western blots. But the other struggle you face is when you are going to write your paper. You know, I have a figure of an entire Western blot. 99% of it's blank except where my band is. But these days you have to show the entire blot.
I think a lot of journals now require you to submit the entire
Raw
image.
Yes, correct. And that's something that's new too, is even though you have a final polished image that you have in your figure, the journal does sometimes want, not all journals, they want an electronic version of the raw data so that they can look at it as well. Substituting one subject's record for that of another subject if you're doing clinical research. Inflating the number of samples, animal subjects that were used. Deleting data points, as we talked about in the beginning. Altering images to appear better. Altering images and using them multiple times. So this is another classic that's gotten people in trouble. I did a Western blot, I got my image. I need another Western blot. I'm going to flip that one over. I'm going to flip it around so the bands will go the other way. You will get caught doing it. Trust me. Very easy to catch people. You know, when you do that Western blot, you get that little bleb of nothing up here. Well, that little bleb is going to be on the next figure. And once people can use their computers to flip those images around and overlay them, you're busted. That has been a very common thing that has resulted in a research misconduct finding. It's reusing images over and over and over again. So why do people do it? Again, career pressure. Publish your pairs. You need to get tenure. Got to get a grant. Got to get some papers. I want to be famous. My biggest competitor is getting ready to publish paper. I need to be ahead of him or her. So I got to get my paper out. So I'm just going to make up the last 2 experiments to get this done and get it written. Of course, there's character issues, laziness. The ease of which you can do it. You could sit at your computer with some random gels and make up all the data you want now. To make whatever figure you need to make up. Personal problems, cultural differences, and reasons that we don't even know about. So here's our graduate students struggling with, do it or don't do it. The answer is always don't do it. Frequency of scientific manuscript retraction. This is an article from the New York Times. The reference down there in the bottom left. You can read that as well. Again, the number of retractions are becoming more and more commonplace. This went out to 2009, which is shown in this graph. Oops, this graph here. The last time point is 2009 because that's when the article stopped analyzing the data. And you can see there we have the brown is fraud or fabrication. Scientific mistake is the dark silver, and then the light gray is other. So it's not always fraud or fabrication. It's other reasons that papers get retracted as well. So we're going to go through some real-world case studies now. Does anybody subscribe to something called Retraction Watch? You should, because it's fun reading sometimes. So they have a website now. It's called Retraction Watch, I think. Yeah, just type in Retraction Watch. They track everything in this area, and they publicly acknowledge everything in this area, and it changes on a daily basis. So anytime the NIH finds somebody guilty of research misconduct, it goes up on their website immediately. It will talk about ongoing investigations as well. So
Also, anytime there's a retraction,
Yes.
you could sign up for their daily email. So each morning I'll read about.
they also have a Facebook for those of you that are Facebook aficionados, you can like them on Facebook now and just get it with your Facebook feed. All right, so research misconduct, case study 1. And these events really happened. Informed consent documents for a research study contained multiple places for a participant to sign. The audit of the study revealed that on some of the signed informed consents, signatures on one part of the form did not match signatures on another part of the form. Some signatures appeared to be forged. Is this research misconduct? Oh, you guys are pretty strong about that. Are you sure it's research misconduct?
Absolutely.
So those of you that said yes, tell me why.
Because it's probably what happened is they forgot to sign one page, and then you go back and instead of having them do it all over again, you just. But no, it's you can't sign somebody else's signature.
Inconsistent.
That's forgery.
Sure is.
Okay, we'll find out what the decision was. No,
Why
it's not
not?
research misconduct. So if I will go to my next slide, I'll explain the finding. Okay, so it's more of a non-compliance with federal regulations regarding obtaining informed consent. It was determined not to be a material failure to comply with federal regulations, nor did it constitute falsification of data or plagiarism.
But it's
The
forgery.
matter was reported to an appropriate federal agency as a serious non-compliance, but not as research misconduct.
But it's forgery. Like I can't sign somebody else's check.
I don't disagree with you.
Part of the research.
But in terms of, did these people try to obtain informed consent and adhere to their IRB approved protocol? Yes, they
Yes,
did.
they did.
Happen to know about this one. The committee members didn't consider the consent form signatures to be data. So
Correct.
again, the definition is fabrication of data, falsification of data,
Oh.
plagiarism of data. So
Right.
this was considered.
So it might be against the law, but just
Yeah.
not misconduct.
And I will say, as a non-compliance issue, they could still get in serious trouble. It's not like they probably didn't get off scot-free, but they could still get in serious trouble. So when you do human subjects research, non-compliance issues can get you in as much trouble as research misconduct. All right, case 2. All came up at the same time. Sorry. Graduate student includes falsified or fabricated data in 2 poster presentations, several laboratory meetings, and progress reports with federal grants. It's obviously research
Yeah.
misconduct. So what if the part about federal grants wasn't there? Is it still research misconduct?
Yeah.
Yes, by today's definition, it is. So, Brandy Blaylock, a former graduate student at Wake Forest School of Medicine, knowingly presented falsified and/or fabricated data in 2 poster presentations, several lab meetings, and progress reports associated with NIH and National Institutes of Drug Abuse grants. She reported that 12 non-human primates responded to anti-abuse nicotinic acetylcholine and/or dopamine receptor selective compounds in self-selectivity assays for cocaine, methamphetamines, or nicotine when the compounds were never given to the primates. So she just out and out made stuff up, data-wise. So she received 3 years of probation. The probation calls for supervision if she applies for or receives PHS support during the probation. Any institution employing her must certify her research for PHS-funded applications or publication. So if you're the faculty member and you get her application in your inbox by email, and you're aware of this, or you become aware of this, because I'm assuming she's probably going to want to tell you this, because you're going to find out at some point, would you hire her? Right. No one's going to hire her, correct?
No.
Because why would you want somebody that's done this already once? And why would you want to go through all of this hassle of verifying your research and certifying it for all your grant? And you wouldn't. So I'm not sure where Brandy is now, but I would be hard pressed to believe she's doing academic research. All right, case 3. Faculty member developing personalized cancer treatments based published. Sorry, I think I'm missing part of a sentence there. Based on genetic findings, publishes his results and performed human clinical trials on falsified microarray data. That's obviously research. This is a real case from Duke University. So it happens even at our most prestigious universities. And I'll give you his name in a second. There was a huge story on him on 60 Minutes. So if you ever want to see it, I suggest you look at it because we talked about somebody who was kind of a true believer. he, I think, really thought that what he was doing was legitimate and real. So he was kind of a zealot, kind of like the woman that, what was that biotech company that was in the news all the last couple of years?
Yeah.
She truly believed that what she was doing was working. Theranos.
Yeah.
And if you haven't seen that documentary, look at that documentary. So Anil Patil, and again, if you just type his name in to Google, you will find it. The whole 60-minute story will come up. He was at Duke. He was performing research on the development of personalized cancer treatments based on specific gene expression signatures that predicted a patient's response to chemotherapy. He also embellished his resume, they found out later. So he published 27 papers. They were all retracted. And he was in the middle of an ongoing, he had a clinical trial ongoing. Of course, they terminated that because there was no data to support what he was doing in those patients. So as part of his settlement, he neither admitted nor denied their findings of research misconduct. And he had to be supervised for research for 5 years. And Duke had to repay the grants that were funded for research. So actually I have the little video link down there at the bottom if you want to see it. They did a follow-up story on him, and he was not doing research, but he was doing cancer care at a private clinic in South Dakota, last I heard. Whether he's still there or not, I don't know.
No question.
And Randy is now a financial advisor.
There you go. Thank you for looking that up. I don't think I would trust her with my money.
Why did they settle? Why did they have to settle?
Who?
Like,
Oh, that's not that they settled, but they worked out this agreement that for some reason that was acceptable to the government, that he neither admitted nor denied the findings of research misconduct. So I'm assuming because he was countersuing the government, and so it was just easier to try and get past all of this to work out this settlement.
When ORI makes a finding under the regulations, the person who the findings are against does have the right to appeal those findings first to an administrative law judge, and then it can go up from there. So here, the person accused appealed. There was also some countersuits. So to settle things, the university agreed to just repay all the money, and then the researcher just basically didn't contest
it's just
the findings.
seems very disproportionate compared to the 1 year
Oh,
prison.
Yeah, I mean, this researcher had an excellent attorney.
I'm sure paid a lot of money for it. So if you watch the story, you have some free time, watch it. This is a case just full of hubris and someone who he thought he could do no wrong. He thought no matter what he did, no one was ever going to find out, and he just really wanted to be famous. And I probably was one of those people who thought he might win the Nobel Prize. All right, so case study number 4. Right? I think I messed this up. Oh, okay. So researcher admitted to 2 counts of making false statements in connection to grant proposals and progress reports that contained false data. The result of rabbit sera that researcher was intentionally spiking with human HIV antibodies to make it appear he was developing a vaccine. So that's obviously research misconduct. I think that's pretty obvious to everyone. This person actually got in a significant amount of trouble. So he was at, I shouldn't say he, could be a he or she. I think it's a he based on the name. Former research assistant professor at Iowa State University. There was a 1-year investigation, and they reached a settlement in 2014. He admitted to research misconduct and agreed to a 3-year ban from public health service funding, and he thought that was the end of it until Senator Grassley got outraged because he didn't think the punishment was enough. So they took it even farther with Dr. Hahn, and they brought false claims action, and they reached a settlement on that, and the university had to pay almost $500,000 to the NIH to cover the salary that the NIH had paid for when he was funded by the NIH. And then Dr. Hahn was represented by a public defender at this point. He agreed to repay $7.2 million to the NIH as restitution to the NIH's actual losses due to Dr. Hahn's action. And in 2015, he was sentenced to 57 months in prison. And I haven't checked the update, but he was appealing at the time. I'm assuming he did not win his appeal.
That's correct.
Yeah.
So
And ended up, I don't know if they ended up paying $7.2 million back. Not that ever happened.
No money has been
Right.
repaid. That's been a debate too. That, but ORI's point
because again, there was a settlement here I mean, this judgment brings no value to the taxpayers and
Correct.
public health service because it's never going to be paid.
Correct.
So why don't we negotiate something that
Could be paid.
that is actually doable?
Right.
But then, as Dr. Brunel said, the senator got involved.
Do you know, did he end up going to prison?
He did.
He
Yeah.
did.
Yeah.
All right, so case study number 5. This one has not been decided yet. The part of the reason I put it in there is because it happened at Purdue University. But it's also a very entertaining story. So this Dr. Hahn, a professor of mechanical engineering and technology and the director of the Purdue Center for Materials Processing Research, and you go to the Purdue website, he's still on there, and his wife owned a privately held company called Hans Tech. So they were the company was the recipient of multiple grants from the National Science Foundation Small Business Technology Transfer and Small Business Innovation Research Program. So NIH and NSF have these programs where companies can apply to help develop a product. They were very good at getting these grants. They received over $1.3 million in grants in the NSF. Surprisingly, he and his wife were indicted for fraud because they ended up using the grant funding for their personal.
The house.
And wait till I tell you what they did with it.
Oh.
So they paid off their mortgage on one home. They purchased a second single-family home in the same town using grant money. And then they leased that home to themselves, and they paid $3,000 a month from the grant to themselves as rent.
What?
And this is even better. They paid $24,000 to offset the cost of a technical assistant. The research assistant was their child, who was 14 or 15 at the time. And they paid $10,000 for a secretary, who was their 9-year-old child at the time. So this has not made its way through the courts yet.
Yeah.
It's currently awaiting a trial after a federal indictment for fraud. He retains his faculty position at Purdue. Purdue's stance on this is this was done in a privately held company outside the university. He didn't do anything wrong technically at the university. Whether he retains his job after all this is decided in the courts, I don't know. But right now, he technically is still a faculty. Hans Tech had nothing to do with his faculty appointment or role at the university. And I checked, the trial is supposed to start next month. It's been delayed a couple times.
Sounds like this is actually a criminal proceeding as
Yeah.
opposed to a
Yeah.
research misconduct.
Right. I'm assuming there'll be some research misconduct things that come out of it as well. I would be hard pressed to see how he gets out of this without any sort of.
Oh, that's very funny.
But it has not been decided. And then the last one I want to talk to is about sabotage and research sabotage in a laboratory. We often don't think of that as research misconduct, or we certainly don't think of that happening, but it does happen. So a graduate student at the University of Michigan suddenly has a series of experiments on her cancer research project go awry. Samples for Western blot appeared to be mislabeled consistently, and cell cultures died repeatedly. Turns out her media was spiked with ethanol. So when her experiments weren't working, she decided, well, I'm going to go to another lab and repeat all of my experiments. When she gets to the other lab, things work fine. So the student went to the PI, who took the matter to the PI of her lab, took the matter to the university's Office of Regulatory Affairs. The officials actually went to the extreme lengths of installing 2 security cameras in the lab and in the cold room. And they found, watching the video, that a postdoc would go in at night and purposely sabotage that student by putting ethanol in her media. And you all know, if you do cell culture, that ethanol in your media is a good way to kill off your cells really quickly. So they did the investigation. It was a postdoc. He claimed he was under intense pressure, whatever that means. He was prosecuted. The judge sentenced him to repay $8,800 for reagents, $600 in court fees and fines, and then 6 months of probation and 40 hours of community service. The PI had prepared a detailed list of damages, postdoc salary, don't think about, half of graduate students' stipend salary, 6 months of a tech salary, because the tech was involved, and laboratory agents, which turned out to be $72,000 rather than the $8,800. And they settled on a figure somewhere in between these two numbers. The postdoc, while all this was going on, he was from India. He went back to India, so they had a really hard time getting him back to this country too. show up at this trial. All right, lessons learned from the research misconduct cases. Any person involved in research may be responsible for misconduct, regardless of their rank or duties on the project. So for those of you that are graduate students or postdoc who maybe have people underneath you that you're responsible for, you're responsible in making sure their data is believable. Me, as the head of the PI, is my responsibility to make sure your data that you're bringing me is believable. Because it can happen essentially at any level by any person. The majority of respondents, or people that have had these issues, have held technical positions, not doctoral degree holders. The common excuse for research misconducts is excessive workloads and/or time pressure. The other thing that will happen is sometimes you'll be in a lab and it just won't work out. And so if you think about these scientific divorces, sometimes they're often bitter and irrational. And sometimes there have been situations where someone has made an accusation of research misconduct, even though it didn't really happen. I'm mad at you, I'm going to get back at you, so I'm going to accuse you of research misconduct. What's the impact of the findings of misconduct of individuals and institutions? Can degrade the university's reputation or loss of public trust, especially if it happens over and over. And I don't know that a single research misconduct finding would really degrade a university's reputation. There can be physical, monetary, psychological harm to employees, research subjects, students, and or trainees. It can often result in additional regulatory oversight, resulting in greater scrutiny, expanded programmatic requirements, and greater institutional investments. It can have suspension or disqualification of individual researchers. And there can be fines, penalties, punitive compensatory damages, debarment, and legal defense. So the research misconduct process at 2-lane. So these are all 2-lane specific procedures. You can find the policies in the faculty handbook. Hopefully I have the appropriate website in there now. But that's the website if you want to find the policies and read about the policies. They're in the faculty handbook. If you discover research misconduct, you can contact the research compliance officer for guidance. So you're always welcome to reach out to Brian and Lisa and just go talk. Is this really, in your opinion, research misconduct? That I think it is. You have the right to remain anonymous, and you are protected from retaliatory acts. You are accused of research misconduct. You are entitled to due process, so you're not automatically guilty. Contact the research compliance officer for guidance. The office is obligated to protect the confidentiality of the process, and 2-lane does that extremely well. Stages of the process. So there's submission of allegations. There's assessment, which primarily happens in Brian's office by Brian and his staff initially. There's sequestration and notification to the respondent of the allegations. So eventually, whoever the allegations are against, that person is notified. Then there's the inquiry, investigation, and some of those investigations can take years to finish. We've had some go on for years and years. Then there's the formal finding, and then there's the appropriate disposition. Now, usually there is a committee formed for the investigation part. And depending on who's being investigated, it can be faculty, it may be staff in some cases. Is that true?
Right.
Okay. They come up with kind of here's a report, here's what we think happened, here's what we think the outcome should be. That then goes to the university administration. And ultimately the university administration, I'm sure with input from Brian and his office, make the final decision. So investigation of a research misconduct allegation is a serious and lengthy process. Where possible, there's attempts made at an informal resolution by speaking with a supervisor and or responsible academic officer, for example, a chair or a dean, prior to submitting an allegation. When the research involves PHS funding, the PHS Office of Research Integrity must be involved in the process and can override decisions of the university. So the university may come back and say, Dr. Bunnell messed up, but we're going to let him keep his lab and let him keep going on his research. An NIH grant, the NIH can say, no, you're not. Or if you are, we're taking all his grants away from him. I haven't been involved in enough to say if the university's decision and PHS's decisions usually fall in the same arena or not.
They typically do, but there have been instances where they have not accepted our report and asked us to go back and look at some other things. So
Gotcha.
we can be overridden by RRI, and then as we've discussed with the case studies, there's then politics that could come into play.
Sure. So examples of disciplinary action, what's the disposition, what's the outcome? You can get a letter of reprimand and get removed from a specific project. As we saw in some of the cases, there may be special monitoring of future work to verify that the research is valid and real. There can be suspension or expulsion of students. There can be termination of employment for staff, and there can be dismissal of faculty members. So again, this is a very serious road to go down. My advice to you is to never have to go down this road. Actions by sponsors, so NIH and that type of stuff, that type of sponsor. There can be a letter of reprimand. They can restrict expenditures to a specific grant. They can suspend or terminate your grant. They can require a correction of research record, retraction of papers, that sort of thing. Prohibition of individual as a federal agency reviewer, advisor, and consultant. That is a very common outcome. So if you've defrauded the NIH by misusing their funds and performing research misconduct, why would they ever ask you to sit on a grant review panel? They never would. There actually was a case a few years ago where the person was at LSU for a while, but what he did was prior to his arrival at LSU, he would sit on a grant review panel and review a grant. Now, when you sit on a grant review panel, you're looking at other people's unpublished data. So the agreement you make with the NIH is, I'm going to read that grant, I'm going to give you my assessment, and then I'm going to forget I ever read it. You're not allowed to keep them. And you're certainly not allowed to say, hey, that's a great idea. I'm going to go back to my lab and work on it. Well, this person actually did that. He liked the grant. It was in his area. He essentially retyped the grant with his name at the top, saying, these are all my ideas, submitted it to the NIH. It got funded. And it was found out that he had done that, and he was pretty severely reprimanded. I would be hard-pressed to say he's going to have a hard time to find a new job. LSU fired him immediately. This happened before he came to LSU, but they fired him immediately. So again, the ramifications to your career are really going to be severe if you're ever found guilty of something significant. So questions, obviously you can ask questions today. If you have questions down the road, you can reach out to Brian or Lisa. There's their office, their phone numbers, their email. They're busy enough that an email is probably the best way to start. Any questions for me? All right, I came pretty close to finishing on time.
On average, how many grants are submitted a year?
To the NIH?
Yeah, ballpark.
I would say thousands.
I was thinking, was it 10,000, 100,000?
It's probably not 100,000. It's 10,000 to 50,000, something like that.
That's something I think you could look up.
Yes.
Any other questions for Dr. Vanilla?
Thanks for your attention. Wipe them in. I would like that already.
The reader part is
Thanks for the question. Okay, good. So we got everything squared away.
Yeah.
Good.